New tonight, we're beginning our back-to-school coverage this week, and while you are preparing to send your kiddos back to school, you might have a lot of questions about vaccines. We have the latest information you need to know.
It's always nice to see kids ready to learn and to play in sports and get vaccinated and to stay healthy during the school year.
Dr. Martine Schultheis has practiced family medicine for nearly 2 decades. She says back-to-school immunizations are important.
Whoever created the first vaccine, which was in 1796 for smallpox, has been life-changing. It's revolutionary. Vaccines do work. People are living longer. Back in the days, in the 1700s, 1800s, people were dying at a very young age, either from smallpox or polio, rabies, you name it.
When it comes to immunization requirements for back to school, the Illinois Department of Public Health requires students to have 12 specific immunizations against viruses or diseases, like smallpox or hepatitis B, to name a few. Meanwhile, specific school districts might have stricter requirements, with other exemptions allowed.
Nowadays, we see more people getting vaccinations, but there's also a good number of families deciding against vaccinations.
Across the last decade, the state of Illinois has seen a 2 to 4% decline in back-to-school immunization, aside from the meningitis vaccine, which is slowly increasing since the COVID-19 pandemic. Dr. Schultheis says even vaccines against COVID-19 or the flu that are not required by the state should be taken seriously.
Because we're seeing a decrease in the prevalence and the incidence of COVID-19, we're having a decreased number of people getting their boosters.
As students return to crowded areas and packed classrooms, Schultheis wants to remind parents why vaccines should be a priority.
There's higher risk of transmission of a pathogen or a virus or a disease. So it's important to get them right before school starts, but also it depends on the age group.
And before your kiddos get on the bus, she always wants to address any misconceptions.
The misconception is a lot of them think that vaccinations are related to autism or it's related to some other illnesses. And they've done multiple studies about that, and they all come back saying that there's no correlation between the vaccines and autism. Some people say, well, when I do get my vaccinations, I get the disease. For example, if I get my flu shot, I get the flu, so I don't want it. So what they don't understand is the pathophysiology of the vaccines. The vaccine comes in and it trains your immune system so that when your immune system becomes in contact with a real invader, with a real pathogen, with a real disease, it's ready to fight for you.
Schultheis says to, of course, do your own research on vaccinations and ask your school district's nurse what specific vaccines are required.